This video will explain the analog RAPID Appliance technique. The RAPID Appliance is simply a duplicate of an existing prosthetic with a twist. The patient presents with a prosthetic that needs replaced. Teeth are broken down, perhaps there's some chipping, the pink is fracturing, there's some issue. But the prosthetic itself is still intact so that we can create an analog model. So this will facilitate the ability for the laboratory to create a duplicate prosthetic in the lab based on some very simple, straightforward records. So let's go through this real quick. The first step is to remove the prosthetic from the mouth. And when it's removed, capture either digitally or analog the impression of the tissue and the multi-unit abutments. There are techniques direct to implant, but this one is on multi-unit abutments only. This impression will give us the tissue, and we will digitally interact it with the other records so that we can design a prosthetic that meets the tissue. Okay, so upload this to us as an STL file, either through the portal or through your digital impression scanner, or just send it along with the case if it's a polyvinyl impression or an alginate model. With the prosthetic out of the mouth, I'll just show some different images here. But with it out of the mouth, add a multi-unit abutment analog, and you'll add one to each site so that now, just like any laboratory would fabricate, you're going to fabricate a model. So with this prosthetic, with all the analogs, find some type of flask. This is an actual laboratory flask, but it could be a denture cup. It could be any material that will hold a small vat of stone. So pour up some dye stone or some regular base stone and fill it almost to the top. In fact, you could fill it just to the length of the analogs. There's no real science to that part of it. And you can let it set up a little bit, not too much, because you want the analogs to, of course, have some stone that flows in the retentive grooves. But set the prosthetic down in the stone. Let the stone set until it is hard, completely hard. If it's 15 minutes, wait 15 minutes, don't go earlier. And once it's set, see here, there's even a little bit of space below it. You want the analogs to be just above the stone. Don't let it get down in to the stone. We don't need the intaglio of the prosthetic. All we need is the analogs captured. And we don't want to lock the prosthetic down in the stone. So a little bit above the stone is fine. Then take a laboratory putty material of equal size, usually it's a 1-to-1 ratio. Knead it together until you have a nice wad of putty, for lack of better terms, and simply wrap it around and over the prosthetic to completely engulf the prosthetic. And you'll massage it and push it and kind of force it even a little bit into the undercut, not too much, but it'll find its way in there. You can even put a little divot in the middle with your thumb, and that way it pushes into the intaglio of the prosthetic. And then let it set. Whale dent coltine makes a nice putty accelerant and putty material. That takes about 15 minutes. So once it's set, pull off the putty material. It'll be kind of hard to remove, so just give it a good pull. And you can either pull the putty material off or you can pull the flask out. In this case, this is a rubbery flask, so it pretty easily came off of the model. You may have a material that doesn't want to come off, and that's fine. It can stay in the cup. And then next you would just remove the putty, force it off. It'll engage the undercut a little bit, so it may be hard to remove. Now that it's removed, you can see what we have. We have a negative of the prosthetic. We have an analog model, and together with this and a bite and a posing and that impression of the tissue and MUAs, we have everything we need to make a prototype, which is what we'll do. This one came back from the doctor. This is a double arch, which you can obviously do. Just make 2 flasks and a bite as opposed to an opposing model. And from this, you'll try it in. You can do a reline impression underneath it if you need to capture the tissue. If for some reason we didn't meet the tissue, equilibrate carefully and simply physically return with a bite registration, and from that we go to a final restoration. So pretty simple process, very light on the laboratory work, not a lot of lab work here involved, but the patient gets to go home with their prosthetic that day, and you get to send the records to the laboratory. So think of this, the patient gets their prosthetic, but you get to share everything that we need to make a prototype, and that is the RAPID Appliance.